Amiodarone Hcl is a medication used to treat certain types of serious irregular heartbeat, such as recurrent ventricular fibrillation or tachycardia. It is used to restore normal heart rhythm and maintain a regular, steady heartbeat. This medication is known as an anti-arrhythmic drug, and it works by blocking certain electrical signals in the heart that can cause an irregular heartbeat. It is important to take this medication exactly as prescribed by your doctor. The usual daily dosage may vary, but it is typically taken once or twice a day with or without food. It is best to take this medication at the same time each day to help maintain a consistent level in your body. Be sure to follow your doctor's instructions carefully and do not stop taking this medication without consulting your doctor first. Before you start using amiodarone, make sure to read the medication guide provided by your pharmacist. It's important to take this medication exactly as directed by your doctor, usually once or twice daily. You can take it with or without food, but it's important to choose one way and stick to it for every dose. Avoid consuming grapefruit or grapefruit juice while using this medication, as it can increase the chance of side effects. The dosage will be based on your medical condition and how you respond to treatment. Your doctor may start you on a higher dose and then gradually decrease it. It's important to follow your doctor's instructions carefully and not to stop taking this medication or change the dose without consulting your doctor first. If your condition does not improve or gets worse, make sure to inform your doctor. Some common side effects of amiodarone Hcl include nausea, vomiting, constipation, loss of appetite, shaking, or tiredness. If any of these effects persist or worsen, it is important to inform your doctor. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. While many people using this medication do not experience serious side effects, it is crucial to be aware of potential symptoms that require immediate medical attention. These symptoms include easy bruising or bleeding, loss of coordination, tingling or numbness of the hands or feet, uncontrolled movements, and new or worsening symptoms of heart failure, such as shortness of breath, swelling ankles or feet, unusual tiredness, or sudden weight gain. In some rare cases, amiodarone Hcl may cause thyroid problems, such as low or overactive thyroid function. It's important to notify your doctor if you experience symptoms such as cold or heat intolerance, unexplained weight loss or gain, thinning hair, unusual sweating, nervousness, irritability, restlessness, or a lump in the front of your neck. Additionally, amiodarone Hcl may cause increased sensitivity to the sun, which can result in a blue-gray coloring of the skin with long-term treatment. To prevent skin effects, limit your time in the sun, avoid tanning booths and sun lamps, use sunscreen, and wear protective clothing when outdoors. Notify your doctor if you experience sunburn or skin blisters. Vision changes are also a potential side effect of amiodarone Hcl, with very rare cases of permanent blindness reported. If you notice any vision changes, such as seeing halos or blurred vision, it is important to inform your doctor immediately. While serious allergic reactions to this medication are rare, it is important to seek medical help right away if you experience symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed above, it is recommended to contact your doctor or pharmacist for further guidance. When taking amiodarone Hcl, it's important to keep in mind that while it can provide great benefits for those with irregular heartbeat, there is a rare chance it could actually worsen the condition or cause serious, sometimes fatal, side effects. Your doctor may want to monitor you closely, possibly even in a hospital, when you first start taking this medication. It's also important to note that amiodarone may take up to 2 weeks or longer to start working in your body, and even after you stop taking it, the drug can still stay in your body for weeks to months. This means that serious side effects could potentially occur even after you've finished the medication. These side effects could include issues with your lungs or liver, so it's crucial to be aware of any symptoms such as nausea, vomiting, cough, shortness of breath, chest pain, coughing up blood, dark urine, severe stomach pain, or yellowing of the eyes and skin. If you notice any of these symptoms, it's important to contact your doctor right away. Before taking amiodarone, it's important to let your doctor or pharmacist know if you have any allergies, especially to iodine, as this medication may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history with your doctor, particularly if you have liver disease, lung disease, or thyroid problems. Amiodarone may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness, such as driving or using machinery, until you know how this medication affects you. It's also important to limit alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, be sure to inform your doctors or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Amiodarone may affect the heart rhythm, causing a condition called QT prolongation, which can lead to serious symptoms that require immediate medical attention. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. It's important to discuss your medical history and all the drugs you take with your doctor before using amiodarone. Low levels of potassium or magnesium in the blood may also increase the risk of QT prolongation, especially if you are using certain drugs or have conditions such as severe sweating, diarrhea, or vomiting. It's important to talk to your doctor about using amiodarone safely. Older adults may be more sensitive to the side effects of this drug, particularly related to the heart rhythm, thyroid problems, and lung problems. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of using amiodarone with your doctor, as this medication may harm an unborn baby. Similarly, if you are breastfeeding, it's recommended to avoid using this drug as it may have undesirable effects on a nursing infant. It's important to be aware of the potential drug interactions with Amiodarone Hcl. Some products that may interact with this drug include fingolimod and certain drugs to treat hepatitis C, such as ledipasvir/sofosbuvir and sofosbuvir. Additionally, many other drugs besides amiodarone may affect the heart rhythm, including dofetilide, pimozide, procainamide, quinidine, sotalol, macrolide antibiotics, such as clarithromycin, erythromycin, quinolone antibiotics, such as levofloxacin, among others. It's also important to note that other medications can affect the removal of amiodarone from your body, which may affect how amiodarone works. Examples include azole antifungals, cimetidine, cobicistat, protease inhibitors, rifamycins, saquinavir, and St. John's wort. On the other hand, amiodarone can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include clopidogrel, macitentan, phenytoin, certain statin drugs, trazodone, and warfarin. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines, as they can provide guidance on the best time to take this medication and ensure that it is safe and effective for you. If you or someone else has taken too much Amiodarone Hcl and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include weakness, severe dizziness, very slow heartbeat, and fainting. It's important not to share Amiodarone Hcl with others. Your doctor may also need to conduct lab and/or medical tests, such as EKG, chest X-rays, lung/liver/thyroid function, and eye exams while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Amiodarone Hcl, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to store Amiodarone Hcl at room temperature, away from light and moisture. Make sure not to keep it in the bathroom and always keep it out of reach of children and pets. When you no longer need the medication or it reaches its expiration date, consult your pharmacist or local waste disposal company for proper disposal. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.